Hello, I'm Nick Pulio, and I'd like to welcome all of the CityBiz viewers to our latest edition of CEO Interviews. Today, I'm joined by Christine Schuster, who is the president and CEO of Emerson Health, as well as the chair of the Massachusetts Health and Hospital Association. Christine, welcome, and thank you so much for joining us today.
Hi, Nick. It's great to be here. Thanks for having me.
Of course. Now, tell us a little bit about your role over at Emerson. I know from what we spoke about before our interview, it sounds like a vibrant hospital just outside of Boston. Tell us what you do there and how you ended up there.
I'm a nurse with an MBA from the University of Chicago. So I'm kind of the intersection of clinical and business in the healthcare sector. And I've been a hospital CEO in 3 different hospitals in Massachusetts over the last 24 years. For the last 19 years, I've been the president and CEO at Emerson Health. And we serve about 300,000 residents in the Metro West area. So it's a very exciting time to be in healthcare and a very exciting time to be an independent hospital in not just Massachusetts, but actually in the country.
I know. You mentioned before that you're a nurse as well as being a CEO. And you've told me previously that you've had every job in a hospital from the kitchen to the corner office. Tell me about that journey and what unique perspective that does that bring for you as the leader of Emerson Health?
So for me, it all started in high school as a volunteer, actually at the now Melrose Wakefield Hospital in Melrose. And I started as a volunteer there and actually fell in love with the hospital system and the way it worked and caring for patients. That prompted me to go off to Boston University, where I practiced and became a registered nurse, and then was in nursing in different hospitals, Beth Israel and the then University Hospital, for 5 years. And I was a little frustrated because I realized if I wanted to make any kind of change in the hospital setting, that I was really going to need to go on and get into administration. But along the way, I had the opportunity to volunteer and to have paid jobs in just about every department in the hospital. And for me, my love for the hospital got even deeper as I understood how the different systems worked, how everything from housekeeping to being on a clinical floor to being in the lab. And that really is what inspired me to become a CEO and a leader, so that with that understanding, I could make things better for our patients. Because at the end of the day, being in healthcare is really about how we make the patient experience better and how we deliver high quality care, in an affordable way and improve access for our patients. So, for me, it's been a labor of love for a very, very, very long time. And, as I've been able to take on additional roles outside of my president and CEO role, I've been able to influence healthcare not only in the region, but nationally through my work with the Mass Health and Hospital Association and the American Hospital Association.
Great. You mentioned a love of the hospital and a love of that place. You're at Emerson now. What is special about that hospital that makes you love that place?
So for me at Emerson, I was just going to come for 5 years and move on to a larger place. But the community here is my community. It's the community I live in. And there's something really special about caring for your family, your friends, your neighbors, and also being able to take Emerson from what was a very good place to now a great place. Our quality and patient safety is really second to none, both in the state level and also nationally. By the Leapfrog Association, we're rated in the top 2% of all hospitals in the country. So we've worked really, really hard to get to that. I think the thing about longevity in the CEO role, it's really important. And in many hospitals, the average turnover is about 2 years for a CEO. But having been here as long as I have, I've been able to build a strong team. And so we have longevity at the senior leadership level, which then allows us to do the really important work that we need to do, because we have stability in the leadership and we could put programs in that we follow. And it's a continuous learning environment and a continuous improvement environment. And that allows us to be a highly reliable organization when it comes to care delivery. And who benefits in the end? The patients. And that's why we're here. So, for me, being here, being in this community has allowed us to take care of patients. They don't have to go outside of the community unless they need the tertiary or quaternary level of care. And we have a deep partnership with Mass General Brigham for that. So it's all about, being here, taking care of the people who are in our own backyard, and being able to have access to the next level of care when they need it.
Just for context on that community, you're west of Boston, very vibrant place. You're serving your friends and neighbors and family, but also just for geographic context, you're in the greater Boston area, which is known for its healthcare, its hospitals, its biopharma, and it's been called one of the most competitive healthcare marketplaces in the country. How do you stay competitive in that environment being a smaller player?
So we're a medium-sized hospital, about 400 million in revenue, and we're competitive because we're high quality and low cost. And so that's what everyone is looking for in healthcare today. You want to go to an organization that's recognized externally, so by the Joint Commission, by all the outside agencies that rate you. So you want to be able to have those high quality certifications, ratings, but you also want to deliver your services at a lower cost. That's very important for our patients. It's important to the insurers. And then you want to be affiliated with a system that's also known for its quality and its excellence. And so for us, it's Mass General Brigham. And we've been able to work with them very closely, to grow together with them. And so I feel like we're have the best of all worlds here for our patients.
And expanding the lens here, looking beyond just Boston, beyond Concord, where you are, healthcare nationally has just faced a tough time in recent years. First, we had COVID, staffing shortages, funding challenges. It seems to be an industry that keeps taking hit after hit. What strategies should leaders employ navigating this constant string of challenges? It seems like you can't catch a break.
Well, you're right about that. That's how all leaders in healthcare feel today. However, we have to move forward if we're going to continue to be a viable option for our patients. So we're really struck by the vestiges of the pandemic. So, by that I mean during the pandemic, many people left the field. Either they were close to retirement, they had someone at home who was compromised and they didn't want to bring anything home to them, or many clinicians suffered burnout. As a result of that, and a result of more people coming to the hospital, we were overwhelmed. And so we had to look at a different labor level, and that is something called travelers or temporary labor that is sometimes twice as much as what we would pay a regular staff person. In addition to that, as you know, not just in the healthcare sector, but in just about every sector across all industries, there's inflation in materials. And for us, things like medical surgical supply costs, drug cost, infusion cost, construction cost. So we kind of got a double whammy. So labor went up and also supplies and materials went up. In most industries, what you would do to respond to that would be to increase your prices. And with that, you'd be able to offset the losses. But in healthcare, we're bound by, at the federal level, Medicare rates, at the state level, Medicaid rates, and then what the commercial insurers will pay us for commercial patients. We have contracts that lock in certain increases every 3 years usually, and we don't have the ability to increase the rates with them. So while all those inputs are going up in cost, we don't really have a way to offset that. And so that's really what's created a lot of hardship in the industry. You see service line closing, you see a lot of layoffs, you see a lot of consolidation. So for us, our strategy is to continue to try to grow, especially in our more profitable service lines like orthopedics and bariatric surgery. We have also had to shutter some services that were not profitable and not being fully utilized as a way to respond to this, in many ways, a crisis. So, we rely heavily on philanthropy to help us during these times, as well as being as efficient as we can in our operations and continuing to deliver that high quality care, but in a very efficient way.
Great. You mentioned staffing. It seems to be the issue on the mind of everyone in healthcare. How do we fix that challenge?
So it is one of the greatest challenges facing us, not just because of the pandemic, but even before the pandemic. We were looking at the aging out of some of our clinical staff, especially nurses, as the baby boomers go off into retirement. So one of the ways we do that is looking at the pipeline. So we have to go back to work with our baccalaureate programs, our associate degree programs, and our technical schools to try to create interest and a pipeline back into the healthcare industry. So that you might have seen the Mass Health and Hospital Association has a very large promotional campaign going on about how wonderful it is to work in healthcare and how rewarding it is. For my hospital, we've created a lot of make your own programs. So, we'll have preceptorship programs and training programs for hard to fill specialties like the OR, the ICU, the emergency room. For roles like surgical techs and IV technologists that will insert your IVs, we have special training programs for them, and many times we'll offer to train you and then give you a bonus or to stay on and work with us for a certain amount of time. So to try to be really, really creative and innovative, we've also reintroduced an LPN program. So not an RN and not a technologist, but something in between. We're hoping that we can continue to deepen our relationships with the colleges, and as they come here for clinical rotations, that people will come here, have a great experience, and then stay on to work full time.
That's great. Looking a little to the future, we talked about our current challenges, what's been in the rearview mirror. When we look to the future, there's a lot of discussion about precision medicine, AI in healthcare. Where do you see the industry going over the next 5 to 10 years?
So I think there's so much promise with AI. Not that it will ever replace what human decision making will do, but as an adjunct to it. So to try to do the pick and axe work of running images or lab tests through an algorithm, and then helping to narrow down diagnoses, or having done a lot of the legwork and then having the radiologist look at it. I think chat GPT can also help with writing notes if you put in the correct inputs, to be able to help with note writing and communications within the healthcare sector. So not just on the clinical side, but also on the educational side and on the communication side, both internally and externally. So I think we're so lucky to be at a time when we can experiment with this innovation in a way that's safe, but that can also help us to streamline and reduce the cost of care, keeping that quality really high by using some of these technologies to help us to advance in all aspects of the field, not just the clinical side, but the administrative side, the communication side. So I'm really excited to be a part of all those innovations as we move forward over time.
The future looks promising indeed. Well, Christine, thank you so much for joining us today. This was great, highly insightful. We really appreciate the time.
Thank you so much for having me. It was really nice to be able to share more about the healthcare environment with your viewers.
And that's a wrap for this edition of CEO Interviews with CityBiz. We hope you'll join us next time.